Assessment and Treatment of Spinal Cord Injuries in Football by Daryl Thompson and Gerard Talbot-Paul. Now, what is a spinal cord injury? From Medscape.com, they define a spinal cord injury as an insult to the spinal cord resulting in a change, either temporary or permanent, to the cord's normal motor, sensory, or autonomic function. The NATA position statement on preventing sudden death in sports calls catastrophic cervical spinal cord injury occurs with structural distortion of the cervical spinal column and is associated with actual or potential damage to the spinal cord.
Okay, different types of spinal cord injuries. We have our cervical spine injury, like we learned in just class, like C-spine, stabilizing C-spine. We have our thoracolumbar or spinal cord injuries, like we learned in Rose's class, our path class, as in our spondies, our pars interarticularis breaks, spinal stenosis, disc herniation, and facet syndrome, and chronic low back pain. Okay, so the mechanism of injury for these spinal cord injuries, for the cervical spine injury, is usually during axial loading, meaning when football players have their neck partially flexed and they hit like the crown of their helmet, like the top of their helmet, and basically crushes their spinal cord, leading to dislocations and fractures. For our spondies, we have hyperextension, along with pars interarticularis breaks. These usually happen in football players and gymnasts when they get maybe tackled from behind, get the hyperextension, and gymnastics if they happen to fall and have severe trauma. We have spinal stenosis, either central or lateral. Usually comes from either congenital or narrowing of the spinal canal. So basically, you pass down from generation to generation, or you have hypertrophied facets or ligaments narrowing the spinal canal. We also have disc herniations that can happen from hyperflexion or improper lifting and compression and rotation forces. We have our facet syndrome, which happens through like direct trauma to the facets, causing a locked joint, meaning the facets are basically clamped together and you can't really move it. We have finally the chronic low back pain. It's usually like back pain dealing with poor posture for some cases, and the pain is usually greater than 3 months. So our friends Daryl and Todd have lordosis and flat back, so they usually have low back pain for a long time due to their posture.
Now, there are some ways to prevent spinal cord injuries. In 2012, Heads Up Football program was created by USA Football. They partnered with the National Football League. Heads Up Football program is a program developed for youth football to teach them the correct ways of tackling with their heads up and not leading with the crown of their helmet to prevent from that axial loading of the cervical spine to prevent fractures and dislocations. Another way to prevent spinal cord injuries is the equipment enhancements that have happened throughout years to years. The big thing is the proper fitting of the equipment. All these new helmets and everything, they won't work if you don't have them fitting properly. Now the thing is, even with these new helmets and everything, it doesn't stop any of the axial loading responses that happen during football. Now there are some new rules in the National Football League and the NCAA for the defenseless players. A defenseless player is said to be a receiver attempting to catch a pass or who has just caught a pass but has not had time to protect himself and has not clearly become a runner. Now, in this, the defense is not allowed to forcibly hit the defenseless player in the head or neck area with any part of their body. And the big thing is the defense is not allowed to lower their head, making a forcible contact with the top of the crown, any part of the helmet against any part of the defenseless player's body part. So this new rule is going to help out because Wes Welker, almost wide receiver for the Broncos now, almost had a career-ending injury from a defenseless hit that he had against him. In the NATA position statement, Acute Management of Cervical Spine Injury Athletes, they say there's 3 things that health professionals and athletic trainers need to do and that they're responsible for. First thing is knowing the safety rules and ensure that the safety rules of the sport are being followed. That's a big thing. The second one is being responsible for protective equipment and the manufacturer's recommendations. So as we learned in our risk management class how to properly fit helmets and shoulder pads, we need to make sure that we go through with that to try and prevent these spinal cord injuries. And lastly is to educate coaches and the athletes about the mechanisms of these spine injuries. Not just say don't lead with the crown, but show them why and how when they lead with the crown of their head of what the severity of the injury can be.
So we have different ways to assess spinal cord injuries. We have on-field and in the clinic. So on-field assessments usually is your C-spine detecting on-field kind of axial loading football injury. So you usually when we're running on the field, we're looking for before we even palpate or anything like that, we're looking for any posturing like the decerebral or decorticate. We know that decerebral is the worst one. Injury to the brainstem, meaning it's injury to the primordial functions of the body, like breathing and so on and so forth. And we're also looking for any signs or symptoms, asking the player or athlete, are you feeling any numbness, tingling, any pain? And while we're palpating, we're seeing if there's any pain or tenderness in the C-spine area. And we're seeing if the athlete has range of motion issues and monitoring their vitals. If any of these tests are positive or we're unsure of if we can't clear the C-spine, we definitely have to call and ship them with EMS.
All right, well here in this video you're going to see a Rutgers football player, Eric LeGrand. He's a defensive tackle and he's on special teams and he just goes in and makes his tackles. Well, axial loading happened on him because he led with the crown of his head. He actually ended up getting a C3 and a C4 fracture. The game took place October 26, 2010. As you can see here, the athletic trainer's taking C-spine, his partner here taking the mouth guard out of Eric LeGrand's mouth. The good thing for the athletic trainers here was Eric was actually conscious during this. He just said he couldn't move the rest of his body. Eric now is paralyzed from the neck down. He still can't walk to this day. Once they got him off the field into EMS, he had surgery for 9 hours. When he came out of surgery, he had 0 to 5% chance to regain any neurological function. Today, he can breathe on his own. He can shrug both of his shoulders. He can stabilize his own neck and head. And he's starting to be able to stabilize himself while sitting upright. And also while sitting upright, he's able to shift his weight from one side to the other. So therapists are very happy with how long he's come along. And he's really starting to fight against spinal cord injuries. He's trying to show that nothing's impossible. What you see there leads with the crown of his head, and he goes straight down. And here's a better view of it. And that's why there's a heads-up program in youth football now, trying to make sure that these people the athletes don't lead with the crown of their head. And now you can see all the athletic trainers spine boarding and doing their protocols. And just like you saw in this video, the emergency action plan that was put in place, the head athletic trainer stabilized C-spine. He kept his head neutral, didn't let go. He got his help. EMS arrived with a cart. The other health professionals, they removed the equipment like the mouth guard to make sure their breathing was good. They immobilized him on the spine board, and they actually did a 6-person lift to get him up off the ground. And that was their emergency action plan.
So here we have our in-clinic assessments of spinal cord injuries, our favorite, right? So this is where we do our thoracolumbar, even cervical spine evals. Cervical spine we probably learn next summer. This is where we do all our special tests, our range of motion, our muscle length, just to see what exactly is going on with our athlete or our client. And nothing really big here, but it's just our in-clinic evals are more specific, trying to get a comprehensive view, trying to help people with rehab and getting back onto the field. Yep.
Now there are some different types of treatments for spinal cord injuries, but the main thing is it depends on the severity of the injury. So in like Eric LeGrand's case, treatment for him was surgery. He had to get surgery for his fractures. Sometimes maybe they just have a stinging pain or something, some neurological, nothing real serious. Maybe we can do some different types. Now we found some articles on different types of treatment for spinal cord injuries, and the first one that we found was on training the muscles used for breathing again. Because after neurological damage, especially spinal cord injuries, those muscles that are used for breathing, um, they're weakened, the lung capacity is reduced, and the ability to take a deep breath and cough, it's not there, and lungs become at a greater risk for lung infection. Now, in the article that we found on PubMed Health on training the muscles used for breathing, uh, there's small beneficial effect of respiratory muscle training on the lung volume and the strength of the muscles, but there was no effect seen on the maximum amount of air that could be pushed out in one breath. So there's some debate still on it, but it's one thing to consider when treating an athlete after a spinal cord injury.
So another article that we found, which was pretty cool about hypothermia rehab from American College of Sports Science, says that it's usually used in experimental. Well, it was used in only in experimental models of spinal cord injuries, and it's been it's usually moderate hypothermia has been shown to improve functional recovery and reduce an overall structural damage in spinal cord injuries. Um, Hypothermia is basically like cryotherapy on steroids. So it's just like extreme cryotherapy. Um, Hypothermia has been used for many years to protect nervous tissue from various injuries, including cerebral ischemia and trauma. It's also been used regionally to reduce spinal cord temperatures during surgical procedures, such as decompression surgery. So for treatment, hypothermia is usually initiated 30 minutes after trauma over subsequent weeks. um, the studies that have been the studies that have practiced hypothermia showed relatively dramatic beneficial effects of modest hypothermia in terms of improved walking and reduction in damage to both gray and white matter structures. These experimental treatments have shown efficacy in animal models, uh, but few have translated successfully to like um, clinical use. So hypothermia is basically just a experimental rehab for right now. Finally, a really interesting article is about ketogenic diet for rodents with spinal cord injuries. Um, if those who don't know, ketogenic diet is a high-fat, low-carbohydrate diet. It's usually used for patients with epilepsy, and the ketones reduce neuronal excitation and promote neuroprotection. And the ketogenic diet also acts through other factors like being a antioxidant. It's used as energy metabolism since it's high fat. The body uses the fat as for energy. It also helps program cell death and anti-inflammatory effects. In this article, uh, the ketogenic diet for the rodents with the spinal cord injuries helped um, forelimb functional recovery. It was evaluated for 14 weeks and it improved functional recovery. Also, it improved pellet retrieval with recovery of wrist and digit movements. Importantly, after returning to the standard diet after 12 weeks of ketogenic diet treatment, the improved forelimb function remained stable.
And here are our references pages. Uh, we use a lot of different references between our PowerPoints, Medscape, Pub Health, the NATA position statements, and the heads up defense. And here's the continuation of our references: risk management PowerPoints, YouTube video for Eric LeGrand, and some of the other articles that we use for our treatment.
And that's all, folks.